WHO is very concerned over the evolving situation in China, with increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
The rates of vaccination in China, while on the face of it are high, they still lag behind in terms of overall coverage, particularly when you look at people over 60, particularly when you look at full vaccination, which I think in the case of the available Chinese vaccines would likely be 3 doses of vaccine as a primary course, not 2 plus a booster. And I think we're talking, protective efficacies of hovering at 50% or less for those 2-dose regimes in someone over 60. That's just not adequate protection in a population as large as the population of China. China made massive progress over the last number of weeks in actually rolling vaccines out. I think there has been a 600% increase or more in vaccination rates over the last week or 2 weeks. So I think what we're seeing is that China is recommitting itself to that strategy. It's distributed many different vaccines in its arsenal all around the country. It's setting up vaccination sites. It's targeting that vaccination. Although we're not involved, we believe there are discussions going on between the Chinese authorities and at least one of the mRNA manufacturers around registration of their vaccines and also around production within China itself. But we're not privy to those discussions. We would encourage that, obviously, and maybe, Rogerio, your group works very much on this. We would certainly encourage that kind of work, both to import vaccines but also to find arrangements where vaccines can be produced in as many places as possible.